Virtual hugs to everyone as we navigate through the coronavirus and deal with our new normal. So please excuse any background noises as my family and kids are all working and schooling from home today. Next slide. The Rhisopathies Network's mission is to advance research of the rhisopathies. We are a volunteer-based organization. The rhisopathies are a group of genetic conditions caused by mutations in genes on the RAS-MAPK pathway and affect cell growth and cell regulation. These are mostly gain-of-function mutations, and 30% of cancers lie on this pathway. These syndromes have many clinical features in common, such as distinct facial features, developmental delays, cardiac defects, growth delays, neurological issues, gastrointestinal issues, and sometimes cancer. Next slide. So the 21st Century Cures Act started with a story about two princesses, Brooke and Brielle, who have SMA, or spinal muscular atrophy. They met with Congressman Upton, the former head of Energy and Commerce, in 2014, looking for treatments. Congressman Upton was hearing from a lot of constituents without treatments and decided to create a bipartisan bill with Rep. Diana DeGette called the 21st Century Cures Act, a bill designed to help accelerate medical product development and bring new innovations and advancements to patients who needed them faster and more efficiently. They started by asking all stakeholders to submit draft guidance, including patients and families. I submitted draft guidance after RDLA informed me of Energy and Commerce's call for submissions. I was contacted by the Energy and Commerce Committee, and the 4 drafts of the legislation were shared with me and other stakeholders. New Jersey rare disease advocates, including myself, also worked together to request a roundtable of stakeholders in New Jersey during RDLA's in-district lobby days to create more guidance and attention to 21st century cures. My son Max also became a fierce advocate for cures, drawing pictures and speaking to members and their offices. Cures was eventually passed the day after my son's birthday, December 13, 2016. It was passed not because of my family or Brooke and Brielle. It was passed because the rare disease community came together as one to show our strength in numbers and share our stories and our needs, especially the fact that more than 90% of us do not have treatments. Next slide. So the implementation of cures at the National Institutes of Health. The Cures Act provided the NIH with resources to accomplish its mission to improve the health of Americans. The bill included billions of funding, but that money needs to be appropriated every year by Congress. It helped alleviate administrative burdens that can prolong the start of clinical trials. It allowed researchers to more easily attend scientific conferences. It advances data sharing, improves privacy protections, open new funding opportunities for junior investigators. It encourages inclusion of diverse populations, and it improves clinicaltrials.gov. In fact, there was just a recent survey was just completed to help modernize the site. And there's also a public meeting scheduled for April 30th, but check with the NIH for updates if that meeting is still going to be running on the 30th. Also, it funds innovative projects like the Cancer Moonshot and Brain Initiative, to name a few. But you can click on the link in the slide to read the NIH strategic plan for more details on the 21st Century Cures implementation. Next slide. So implementation of cures at the Food and Drug Administration. Millions in funding were given, but again, must be appropriated by the government every year. Cures help create more tools for the FDA to support product development in safe and effective ways. It created novel trial designs. It created dedicated patient engagement staff at the FDA. It included patient-focused drug development by providing information on how it is reviewing experience data in drug reviews. There's also a new subsection called patient experience data that is now included in drug and biological review documents. The ability to use electronic health records in the review process, And you can click on the link to check the FDA deliverables to learn more. Next slide. So when Cures passed, my son looked at me and said, "We did it. Everyone's cured." He was only, 5 or 6 years old, and he thought signing that paper would mean we all had cures. And I just had to explain to him that this was just the beginning, that even though Cures helped bring gene therapy treatment for SMA, spinal muscular atrophy, and sickle cell patients, and encouraged the head of the NIH, Dr. Collins, to start actually using the word cures and not treatments, there's so much more we need to do for the more than 90% of rare disease patients who do not have treatment. So Rep. Upton and Rep. DeGette are getting the band back together, the cure makers, this time for Cures 2.0. They asked stakeholders for draft guidance in December of 2019, and last month they started to put pen to paper. I know Steve will go into more detail, but this new legislation will focus on how technology can be used to improve care management and focuses more on access issues. And I'm so excited to see all of the rare disease community band together again to create even more help for our families and to save even more lives. It's amazing what we can accomplish when we come together. Thank you.